Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq. Joining me at the market site in Times Square, New York City, we have Juan Pablo Segura. He is the co-founder and president of Babyscripts, and we're going to take a look at digital tools for better pregnancy care. Juan Pablo, welcome to Market Site, and access to prenatal care is an issue in the U.S. and globally. How is technology helping to alleviate that?
So first of all, thank you for having me.
Got it.
Yeah, and so as you mentioned, access to care in pregnancy care is a huge problem in the United States of America. We have an OBGYN shortage of about 9,000 providers in the U.S. currently. 50% of counties in the U.S. don't have a practicing OBGYN. And so when we started Babyscripts, we thought a lot about how can you deliver more pregnancy care at home through technology instead of having patients always come into the office or to see a provider. And so what we do at Babyscripts is we essentially ship kits, they're called mommy kits, that are connected to an app of ours that allows us to remote monitor patients in the patient's home. So blood pressure cuffs, weight scales, internet connected technologies combined with the app is how we start to solve these access to care issues.
That's pretty incredible. Not even access to care, but if you have a family, you can't just always get to the doctor's office.
Oh yeah.
For something as routine as blood pressure, assuming that you have a healthy pregnancy that's moving along. So to automate prenatal care with digital tools is pretty incredible, even outside of the access.
Oh yeah, well, when you start to look at kind of the different pieces of the healthcare experience, yeah, from an infrastructure perspective, there aren't enough providers, and so we have to start thinking about how do we automate certain parts of routine care, allow providers to focus on high-risk patients, so that's important. Patient care and convenience, the patient experience. Most women aren't at home anymore, they're working, and so for them to take 4 hours off of work to get seen for 5 minutes by their provider is a terrible healthcare experience. So most of our customers are health systems, and we really work with them to transform how they think about and how they deliver pregnancy care at their clinics and work with their patients.
I mean, this is pure speculation, but you would think it would also deliver better pregnancies because the mother's just going to be more into it. She's basically doing the medical care on her own through a virtual pregnancy.
So I'll give you a data point.
Yeah.
We collect more than 40 times the typical blood pressure, weight data, for example, that's captured in the clinic now at home through a remote monitoring. And so we've already had multiple life-saving interventions. In the US, we have a huge maternal mortality problem. We have the highest maternal mortality problem in all developed countries. And if you're black in this country, for example, you're 50% more likely to die. And so there's racial disparities, there's access problems. And so we think technology can play a huge part in starting to solve and close those barriers to care.
It certainly does level the playing field there. Do you think that this can extend to other areas of healthcare as well outside of OBGYN?
Absolutely. There's a renaissance, a revolution, a lot of R words here on the future of care and technology. Every hospital is trying to figure out how to best integrate these tools into their workflow or into their practice. And so I think in the next 5 years, you're probably going to see about 60% of interactions done digitally instead of physically.
I find that really encouraging because preventative care also ultimately drives down the cost of longer-term health care if you're taking care of yourself now versus worrying about it when you are already in the throes of a disease, something like diabetes or heart disease. More of your background, did you come from the medical field or technology field? Is it a combination of the both?
I actually came from outside of both fields. So I had a crazy vision. I was a frustrated consultant, and so I looked to do something new. And actually, my mom was the inspiration for Babyscripts. I'm one of 6 kids.
Wow.
She had 3 miscarriages, though, growing up, and so there's just a lot of questions that are unanswered throughout the entire maternity journey. And so I said, you know what, there's nothing better than to give something back to my mom because she's given me a lot. And it's just been an incredible journey. We're now in 50 health systems, 25 states. We touch about 200,000 pregnancies a year right now, about 4% of the market. So this is, the time is now to change these terrible outcomes, and we're excited to be a part of that solution.
All right, Juan Pablo, thanks so much for joining us.
Thank you so much for having me.
And thanks for joining me on Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq.